So welcome to the first Hemophilia Council of California webinar for 2023. I'm Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California. And we want to thank you for joining us this evening. So these are some issues that are not necessarily, they have budget implications and are things that have been introduced in past budgets. Or they are sort of ongoing policy issues that we wanted to mention that will be critical this coming year. So many of you may already be familiar with Medi-Cal RX. That is a governor's proposal that kicked off really, there were a number of delays in implementing it. So it really began at the beginning of this past calendar year, so January of 2022. And essentially that was a move to take all pharmacy benefits, so all prescription drugs from Medi-Cal managed care to a fee-for-service way of reimbursing or paying for the medications that you take. So for those that may not be familiar with what all of those terms necessarily mean, essentially what that meant is that it used to be a lot of folks that are on Medi-Cal have a managed care plan that is covering them. So they might be on Medi-Cal, but they might have, Health Net or Blue Cross, for example. And that insurance company would take care of the prescription. Now all prescriptions are handled directly through this Medi-Cal RX. And frankly, there were a lot of hiccups at the beginning of the year. There were delays, there were just problems with the implementation. And so that is something that we have been watching very closely, because obviously for the bleeding disorders community and other rare and chronic disease communities, access to our medication in a timely manner is a very critical really critical manner. And so the state created something called the Clinical Liaison Team, which was specifically assigned to help our, to kind of monitor and help our most vulnerable patient populations, including people with bleeding disorders. And that really helped to smooth out a lot of the issues that we were seeing. But there continued to be changes and adaptations to that program. And so while sort of towards the end of the year, it was going pretty smoothly, we will continue to monitor that very closely. Cal-AIM is another initiative that falls under Medi-Cal, and it is a series of initiatives which are about trying to ensure that Medi-Cal services are really more robust, and that they are excuse me, more of a whole person kind of care, which for us in the bleeding disorders community, that is, that's a concept that we're very familiar with, right? We often, our patients are seen at hemophilia treatment centers by a team of providers that's really looking to address the whole person and make sure that everything is being taken care of. But that isn't actually very typical of the US healthcare system, right? Like, outside of an HTC, most of us, it's like you go to one doctor for this, and then you have to get a referral to another place, and it's very scattered and disconnected. And so at its core, it's an initiative to try to do that, to try to make that care more connected. But it also, and this relates as I transition sort of to the next part, it also is really a vehicle in which more patients are being moved into managed care plans. And as, again, rare disease and chronic disease patients, that is a little bit concerning, because sometimes the managed care model can be too one size fits all for our rare disease patients or our more complex patients. And so this expansion of Medi-Cal managed care, and particularly an initiative that would expand managed care for our California Children's Services patients, so that's our CCS program. There's movement there to try to put more of those children into managed care, and that again is something that we're really working to monitor very closely, and either slow that progress and progression into managed care, and or as that transition happens, really ensure that the right protections are in place to make sure that patients continue to get everything that they need. And then I also put access to new therapies on this slide because, as some of you or many of you may be aware, in November of this past year, the very first gene therapy for hemophilia was FDA approved. So that is a product for hemophilia B. And while it's not our role to advocate for specific products or for patients using specific products, we believe that that's a decision between you as the patient and your provider. We do believe that patients should have access to all FDA-approved therapies. And so now that we have an FDA-approved therapy, we will be working to see how the state decides to treat that and what that process is going to look like in order to have access to that new therapy. And again, any other new therapies. Gene therapy is not the only type of new therapy that is coming on the market to help patients with bleeding disorders. So regardless of what the therapies are, we want to ensure that patients have access to any FDA-approved therapy that they and their doctor together decide is the best treatment for them. All right, thanks everyone.